Mayor, when you're ready.
Well, good morning. Dr. Kane will be on in a moment to go over local data and announce new equity efforts around the vaccine. But I would like to take a moment and make a few things clear right at the top. First, we are overjoyed at the news that any Hoosier over the age of 16 will be eligible for vaccination beginning March 31. More shots in more arms will be the primary factor in determining our exit from the pandemic. With expanded eligibility and more vaccine supply, the light at the end of the tunnel is getting even brighter. So I want to thank Governor Holcomb and the state health department for getting us to that major milestone. We're also grateful, and I personally am grateful to the governor for giving us the flexibility to address the risks that are unique to our particular community. I'm sensitive to the fact that the governor and his decision making has to take into consideration 92 counties. And as I said, I am grateful that he is allowing Dr. Virginia Kane and other leaders here in Marion County allow us to keep the risks that are unique to Marion County at the forefront of our decision making. You know, the truth is, Indianapolis is Indiana's population center, our primary population center. Marion County is unique in so many different ways from any other part of our state. We are twice as big as the next most populous county. Our population is equal to the population of the 45 least populous Hoosier counties altogether. That's quite a disparity. That's quite a difference in terms of density and contact. And while we're moving in the right direction, as far as our positivity rate and other important indicators, the threat of an uptick is not yet behind us. This month, as everyone knows, we are hosting thousands of visitors from inside and outside our state. Soon, travel and economic activity will increase to even greater degrees. I am so happy for the people of the city of Indianapolis as it relates to what we experienced collectively last weekend with the beginning of March Madness, with our downtown sidewalks and streets full of people, with our restaurants and our bars full of basketball fans, enjoying the greatest sight that this city has seen in nearly a year. And while I believe that we can continue to handle these changing patterns safely, we can only do so with the common sense approach that attracted the NCAA tournament to Indianapolis in the first place. For that reason, until the current emergency public health order is rescinded or superseded by Dr. Kane and her team of experts, we will not repeal our mask mandate or our capacity restrictions. We will continue to exercise the local authority granted to us by the state to keep Indianapolis on the right track. Because although the light is brighter, we are not out of the tunnel itself. Make no mistake, we have a ways to go. I'm sure you all will have questions on this front. But first, before getting to those questions, we have some more news to share. At earlier briefings, we've talked about how historically underserved populations have borne a disproportionate share of the health and economic consequences of the pandemic. And through programs like our Spanish language vaccine appointment call center this weekend, or the COVID Community Ambassador Program, we have tried to remove barriers for these groups to access the vaccine efficiently, effectively, quickly, responsibly. In just a few minutes, Dr. Kane will outline our newest initiative aimed at getting more resources into our hardest hit neighborhoods. She will also outline the details of the first mobile vaccination clinics launching in our city. And of course, we are deeply grateful to the Indianapolis Motor Speedway for the announcement that the governor made yesterday that over the course of several days throughout the month of April, that mass vaccinations will take place at the Indianapolis Motor Speedway. And that is a process that will successfully improve the overall number of people vaccinated, not just here in Marion County, but for central Indiana and the state of Indiana as a whole. So let me conclude by just asking us all to remember we are all in this together. For our city, Indianapolis, to truly thrive, it means that every neighborhood must also thrive. And for us to emerge from the pandemic as one city, it remains critical that each and every one of us continue to do our part. That means getting your shot as soon as you are able. And yes, it means continuing to mask up until we reach that critical mass of people who are immune. We'll get there. We're on the way to getting there, but it will take time. And with that, I'd like to hand it over to Dr. Kane for additional information. Dr. Kane?
For your ongoing commitment to keeping Indianapolis residents healthy. Good morning. Before I begin the data portion of this update, there are a few items I would like to cover. As Mayor Hotsett mentioned, the mask mandate and current capacity restrictions in place in Marion County will continue beyond April the 6th. While our numbers are improved from what we saw last summer, we cannot be lulled into a false sense of security. We are near the end of the race. We can see the finish line, but we have not yet crossed it. Now is the time to dig deep and sprint to the finish. So that means continuing to practice the simple habits of wearing a mask, washing our hands, and watching our distance when in public. Getting vaccinated as soon as you are able. If we all work together to educate our neighbors, our friends, our family, and help them set up vaccine appointments, we will be able to return to those activities we love sooner. Number two, in the spirit of doing this together, today we have two exciting announcements aimed at addressing disparities that have been exacerbated in traditionally underserved communities during this COVID-19 crisis. First, the locations of the first 4 mobile vaccination clinics we will host in partnership with local health entities, IU Health and Eli Lilly. Eastern Star Church will host a vaccine clinic this Friday and Saturday. Dates are to be announced for clinics in partnership with the following organizations: Light of the World Christian Church, and they're going to be partnering with 4 other churches for this event. The Consulate of Mexico in Indianapolis, Riverside Park with Indy Parks and Recreations. And we will have more to be announced following these mobile clinics in the very near future. And now I'm really excited, partnership with the Marion County Public Health Department, City of Indianapolis, and a global nonprofit, Resolve to Save Lives, to infuse $1 million into the communities that have been the hardest hit by the COVID-19 pandemic. So let me say this, to infuse $1 million into the communities that have been hardest hit by the COVID-19 pandemic, our minority communities. So beginning April the 1st through until April the 15th, we will be inviting community-based organizations to submit funding applications for projects that promote the wellness and recovery of the minority communities that have been hardest hit by the virus and its economic impacts. A website will be announced on April the 1st that will have more information, as well as giving details on the simple application needed to apply. Applications will be reviewed by an advisory committee with equity at the forefront of the award decisions. Lastly, as the NCAA tournament continues in our city, we continue to work with event organizers, tournament leaders, local health partners to ensure the health of teams, fans, and our entire community. We will continue to be engaged in contact tracing efforts related to the tournament and providing guidance on our protocols to keep everyone safe. We'll continue to have additional staff conducting surveillance, spot checks in and around the downtown area, working with business partners to help them operate safely within the constructs of our public health orders, and taking enforcement actions when absolutely necessary to protect public health and our community. And now I will walk you through the data we're currently seeing in Marion County. If I could have the slides, please. So when we look at the county, the state, and the world, you will see that we had a huge rise in our cases around the same time, starting in late October all the way through February. And now we're on the decline. And that's the same for Marion County, Indiana, and even the United States. Next slide. And this really highlights tremendously where you saw our largest surge, which was back in April of last year, the tremendous accomplishments we made all the way through September, and then we had our second major surge. But look, since February, you can see the substantial decline that we had in regard to our percent of persons and our positivity rate here in Marion County, where we're now down to 2.8% in our month of March. Remember, our gold standard is 5% or less, and we have been at less than 5% now for nearly 1 month. Phenomenal. We are definitely at that finish line. Next slide. When we look at the number of cases that we're seeing on a daily basis, on a 7-day average, you will see that we are also, for our newly confirmed cases, we're in that range of in the 80 to 90 to almost 100 cases on a 7-day average. So where we were experiencing 1,000 cases in the month of December, we have broken to less than 100 cases to date. But that has not gone on at least 2 or more weeks. So we need to see both the metrics of the positivity and the metrics of the newly confirmed cases. And that gold standard is less than 35 cases per day. And we need to see that for at least a minimum of 2 to 3 weeks as well, alone for our positivity. So we met one metric guidelines, now steadily working on newly confirmed cases, and you can help make that difference for us. Next slide. With our ED visits, with patients who have COVID-19 symptoms, we are starting to see a slight increase related to that compared to just about a month ago. So we're keeping our eyes on that very carefully. Next slide. When we look at our deaths, we're still experiencing less than 1 death a day. So far, I think with the significant efforts related to our vaccinations to our highest risk populations has really made a dent related to this, but also our other infection control protocols implemented by the residents of our communities. Next slide. Now for those new cases per 100,000 residents in central Indiana, how do we fare with our surrounding counties? So as you can see, the county with the lowest new cases per 100,000 residents is Shelby County. They're experiencing no more than 6 new cases per 100,000 residents. That's phenomenal. Shelby, kudos to you. But the next group, you will see that Marion County, Hendricks County, Morgan County, and even Boone are in that next category with the fewest number of new cases per 100,000 residents in central Indiana. But Hamilton and Hancock are really not that far behind. So we're all doing very well compared to our last public health announcement. Next slide. Now, the other interesting piece is the number of cases that we're seeing broken down by age. And so who's experiencing the highest number of cases? Well, the good news is that you look at the right end of this graph, and you will see that all age groups are basically have declined significantly, with maybe a slight increase for our college students, 18 to 24, but they are starting to trend even more downwards as the top number of new cases for our community. But we're doing fantastic for our children ages K through 12, which is ages 5 to 17. And our less than 5-year-olds, when we look at the community spread of coronavirus in our children and the safety that has been involved, I just can't see enough about our school personnel, people in the leadership, the staff that works constantly. They're doing a phenomenal job. And and we're making great inroads with our other age group populations. Next slide. Now, this is of major interest. So when we look at the cases based by race in Marion County, just in last month, we are noticing that our largest number of cases are occurring in our Asian population at about 8,586 cases per 100,000 population, which this next group is our Hispanic Latino population at 8,270 cases, followed with the lowest group of our African Americans, 5,761 cases, compared to our white majority that is occurring here in our community at 6,805 cases. And let me just remind you, our white residents make up 66% of the cases in Marion County. Our Asian population makes up 3.5% of our community. Our African Americans or Blacks make up 28% of our Marion County population, and our Hispanic or Latino X population make up about 9% of our Marion County population. Next slide. So when you look at the vaccine doses administered each day, we are making significant progress, but we still have a long ways to go. Next slide. This is the percentage of people vaccinated by their age group. So we're over 50% for the age groups greater than the age of 70 and above. We're at about 40% for our age group 65 to 69. And as you know, more recently, we have lowered the age, but we still have a lot of work ahead of us for us to reach what we call herd immunity, meaning that enough people are vaccinated, we don't have to worry about major super spreads in our community. And we have to have somewhere in the range of 70 to 80% of our community vaccinated. So we still have a lot of work cut out for us. Next slide. So these are the percentage of the vaccinations based on race and what have you. So when we look at our white population who are fully vaccinated, we are 13.6%. Remember, they make up 66% of our community. When we look at our Asian percentage of who's vaccinated, they are at 7.7%. And remember, they only make up 3.5% of the population. And then when you look at our African American population, 6.5% are vaccinated, but you know they make up 28% of the community. And then all other races are at 11.5%. If I could have the next slide. So, go back just one more, Mark, I'm sorry. So what's not on here is when we look at the Hispanic or Latino population, of the percentage of their being vaccinated is at about 3.8% compared to 6.5% for our African American population. Remember, Hispanics make up about 9% of our community. Next slide. So when we look at the percentage of by gender who's being fully vaccinated, you will see that we have a higher rate of vaccination in our female population at 13.6% compared to males at 9.4%. Mayor, I just don't want to imply any insult to the males, but I can think you can see how the females are really doing what they can to help protect our community. So, men, you need to catch up with us. Sorry, Mayor. Okay, next slide. Next slide, Mark. Okay, I believe that's the end of
I think that's it, Dr. Kane.
My presentation, and so thank you very much.
All right. Thanks, Dr. Kane. Thank you, Mayor. We'll now switch over to questions. As always, please put your name and outlet in the Q&A box, and I will call on you and we'll get your questions answered. We anticipated quite a number of questions today, so if you could keep yours to one at a time, and then we'll cycle through, and then if you have follow-up questions, we'll get to those towards the end. Today, we'll start with Mickey Shuey of IBJ.
Hi, Mayor, Dr. Kane. I have a question really for Dr. Kane, and it's more of a clarification. You said earlier that, quote, we can see the finish line. I want to be clear on where is the finish line right now? When do you expect that the city will actually be able to roll back these restrictions?
So when we're looking at this, one of the things we had to look at for pulling back restrictions is that one of the things that we're looking for is, we want to know where we are in terms of our vaccination rates, in terms of how are we reaching how are we reaching our herd immunity? So in terms of looking at that. The other factors we will look at is our positivity rate, if we're at 3 weeks or longer at 5% or less, and the number of cases on a 7-day average, 35 cases or less per day for 2 weeks or longer, and we have reached herd immunity with our vaccines.
Thanks, Dr. Kane. Next question will be from Abdul Hakim Shabazz of Indy Politics.
Good afternoon, Dr. Kane. My question was also about the herd immunity. What will it take for us to actually get there? Because you're talking 70 to 80% of the population being vaccinated. Is you just talking about adults, or are we talking teenagers and children? Can you just sort of go into the herd immunity a little bit more and kind of break that down for us?
So I'm glad you brought that up. So one of the things that we're looking at, we're hoping that we're going to reach herd immunity this summer. Okay, it's going to also be based on the vaccine availability. And right now, when we're looking at our 70, 80%, we feel that the vaccines will be available for children sometime this summer. We're hoping by July, early July. But we're going to try to take into consideration right now, looking at our herd immunity, looking at primarily at the adults from right now. So we want to have vaccinated 70 to 80% at least of our adult population for herd immunity for us to feel more comfortable getting back to our normal activities.
Thanks, Dr. Kane. Next up is Eric Berman of WIBC.
Good morning. My question is similar to Mickey's, but I think this one is more for Mayor Hogsett. Mr. Mayor, Dr. Kane just outlined some statistical benchmarks. As you decide when to relax those restrictions, do you need to see those specific numbers, or is this more going to be an intuitive feel in terms of whether we're in position to reopen?
Well, Eric, it's not going to be an intuitive feel. It's going to be driven simply by the data and the science that Dr. Kane and her team monitor. I'll give you a good example. With the NCAA tournament in town for another couple of weeks, with a lot of our students and family members who are enjoying spring break in perhaps other parts of the country. I know that Dr. Kane, and I certainly agree with her, is very interested in seeing what our experience will be, what those numbers will be when we get beyond these events. And so, in terms of projecting into the future, we'll just continue to monitor. I am in full agreement with Dr. Kane and her direction and guidance that until we have greater numbers of vaccinations in Marion County, I think it's only responsible to continue to mask up, to continue to socially distance, to continue to have the restrictions in place. We have lessened those restrictions over time. I think the weekend that we just experienced, I hope, was a very successful weekend for our local businesses. I would anticipate this weekend and the following weekend to be successful for our restaurants and other small businesses throughout, particularly our downtown area. So what I think Dr. Kane, her staff, with me being in agreement is we just simply need more time for more vaccinations to occur, more immunization to occur in a more widespread way, particularly in those populations that have been disproportionately affected. And then B, seeing what the numbers are. As Dr. Kane, I think, very eloquently articulated, we are reaching the goals that we have set for ourselves in several different categories. Overall positivity rate is one of them. But as she also underscored, we still have in her professional opinion and those of the Marion County Department of Public Health, we're still experiencing higher numbers of new cases than we would like to see. I believe Dr. Kane said 35 is the gold standard, and we're not there yet. So it's not intuition. It's simply following the numbers, maximizing vaccinations and immunizations for as many Marion County residents as we can possibly have vaccinated, as effectively and as efficiently as that can happen. And then when we are comfortable that those numbers and those metrics have been met, we may be able to change our public safety orders. But until that time, and until Dr. Kane is comfortable, I am in full support of the efforts that we have announced today.
Thank you, Mayor. Our next question is from Sherry with IndyStar.
Hi, Mayor. I was wondering if you could talk about how you think this is going to impact Indianapolis if it's the lone standout with these restrictions while the other counties around it are going more the governor's way. In other words, what could the impact be for Indianapolis businesses if they are under stricter orders, if people have to wear masks? Thank you.
Well, as I said, I hope that that small businesses, restaurants throughout the city, particularly downtown, experienced certainly a successful, better than probably in the last year, last weekend. I always defer to Dr. Kane on the data that will allow further loosening of the restrictions, but I'd answer the question, Sherry, by saying that we believe that our approach strikes the correct balance for both economic growth and viability, while at the same time keeping paramount the public safety of all residents of Marion County. This kind of approach prioritizes a quicker overall return to normal, I believe, as we keep transmission low while still enhancing and encouraging consumer activity. I read several stories in your newspaper today about how the pandemic has affected people's concern about going indoors with people in circumstances that don't comply with the restrictions that we've placed. So we want to encourage people to feel comfortable to go indoors when appropriate over these next few weeks. But we need to have people wear masks. We need to have restaurants ensure that they are going to be socially distanced. We need to practice good hygiene. And obviously, as has said many times before, we need, and I cannot thank Dr. Kane enough for her effort to take vaccination into neighborhoods and into the communities that so critically need them. I cannot thank the Indianapolis Motor Speedway enough for announcing a mass vaccination process that, frankly, several weeks back was very successful in getting more shots and more arms. And I think as part of the governor's announcement yesterday, I think that there are at least 8 or 9 days, maybe more, that IMS is going to open up for mass vaccinations. All of these things working in concert with one another and us staying together as one city will get us, as Dr. Kane said, to that finish line. We're not there yet, at least not in Marion County, but we're getting there, and we will get there.
Oh, Dr. Kane, sorry, I'm unmuting you now. We can hear you now.
Oh, I'm good. I think the mayor did a great job, and I just want to highlight also for the people out in the community. You know, we now know that we're seeing some variant-resistant strains that are carrying out there, and they're more contagious. It's been identified in almost every state. We're very fortunate that we don't have of the 3 mutated strains that we have the least resistant strain that is now occurring in the state of Indiana. But, you know, it could be happening in our communities, and so we need to have a better observation about how fast those resistant strains are growing in terms of we think how important it is for this mask mandate to take place related to the number of people we're getting vaccinated. So we just have to be very cautious. And like the mayor says, this is more about long-term economic recovery. We don't want to reduce things and then we've shot way back again to another third major surge because we just couldn't stay the course for maybe 1 or 2 more weeks. So it's just really critical that we're doing our surveillance and observations related to that for our communities and our businesses.
Thanks, Dr. Kane. Next up, we have David Williams of Wish TV. David?
Good morning, everyone. I have a 3-part question. The first 2 parts are for the mayor. Mayor, Governor Holcomb recently announced that the state's mask mandate will become an advisory in early April. Do you think the governor acted too quickly? And then my second part, looking ahead to May with the Indy 500 events, talk about that and how things are looking in terms of COVID. Then for Dr. Kane, how do we compare to the rest of the state in terms of COVID?
Dr. Kane, you want to go first?
Yeah, so let me just go first related to this. So first of all, I think in terms of the state opening compared to we're continuing to have our restrictions, like I said, is we just don't know what's going to be happening with these variant resistant strains. And so we're in a race to get as many of our residents vaccinated before any negative impact because these are very infectious strains, more infectious than the current COVID-19 strains that they have, and so could cause significant spread in our community. But I want to emphasize again what the governor says, but the mayor says, that the governor has been very gracious in allowing us to have the flexibility to do what is best for our city, as we have a very different county than the rest of the state with our population density. We're at a much higher risk to have super spreaders because of our population density. And we're hoping that we can continue to see these positive numbers that don't have an impact on our business communities. And the slides that I showed you, at least looking at our surrounding counties, we're doing fantastic compared to the rest of the state.
Thank you, Dr. Kane. I think you answered most of the questions that were directed to me. I think you'd make a great mayor, by the way, Dr. Kane. David, I'm sincere when I say I think Dr. Kane outlined as it relates to Governor Holcomb. I mean, as I said at the very outset, Governor Holcomb has a constituency that he has to be mindful of that is fundamentally different than the constituency that Dr. Kane and I are responsible for serving and protecting. And so to the extent those differences exist, as I stated before, we are just deeply grateful that the governor has allowed us to exercise local authority on these issues. And that's what we plan to do, exercise what we believe is in the best interest for the residents of Indianapolis and Marion County. As it relates to the Indianapolis 500, David, your question as it, I'd say, first and foremost, we all acknowledge that because of what we understand of the virus, outdoor environments are safer. And by the time of Memorial Day weekend, we will have had many weeks, many more weeks of increased vaccine distribution, which I think will certainly play an important role in decision making as we go forward. We will have data that tells us unequivocally whether or not these large events that we are currently hosting has caused any kind of significant uptick in positive cases. And we will continue to work with the leadership at the Indianapolis Motor Speedway. Their team is top notch in every way. I know that Roger Penske and Mark Miles and Doug Bowles and Allison Melanchthon, certainly in our interactions with that team, really put a priority on the public health and the public safety of their fans, as well as those fans who would attend from Indianapolis. So we're going to continue to work with their team. We've got some time and we've got some results that will be available to us that we may not have access to right now. So I defer to Dr. Kane for any other perspective that she wants to add as it relates to, and we're not just talking about let me be absolutely clear. We're not just talking about the Indianapolis 500. We're looking at these data points to be instructive for a return of conventions, to our Indiana Convention Center over the course of the summer, and all of the other activities that will take place. But as it relates to the Indianapolis 500, I'll defer to Dr. Kane for her comment.
Mm-hmm. I just want to say that I think it's a wonderful opportunity for us to be able to have fans at the Indy 500 in May, but it may be very difficult for us to say what that capacity is right now. And we're much further ahead in the game compared to last year when we were at a similar situation related to the Indy 500. So we are hoping to be very optimistic. I'm a fan of the Indianapolis Motor Speedway and what zooms around the track. So, and like Mayor Hotsett says, they have such an outstanding team and the consultants that they've brought to bear related to our safety. And they were the ones who made that tough decision about no spectators last year. So they're very conscious related to the safety of this community. They look at the science as well as us and the evidence. So we have enjoyed a collaborative relationship in terms of reviewing all the data and analysis and its impact on our community. Because I just think we're very pleased to have the opportunity of being able to continue, which is a very major attraction in our community. But we also want to make sure we've got a very safe event happening in our community. But if we're looking at our numbers and how they're trending, I believe we'll have fans at the Indy 500.
Thanks, Dr. Kane. Next up, we have Russ Dodge of WITT.
Well, good morning, Dr. Kane and Mr. Mayor. This is a follow-up on the goal of getting to herd immunity of 70 to 80%. Looking at those numbers, the best demographic right now is 70 to 74, which is less than 60%. It's very good that there are programs like the Speedway and the mobile vaccination clinics, but there's still people that need to be convinced to get a vaccination. What kind of marketing steps are you going to take to just tell people, hey, you do need to do this, and over what period of time in order to help the community get to the herd immunity goals that you have?
I think that's such a great question. And it is clear people have to make their personal choice, but they have to have good information in order to make those choices of getting the vaccination. So we have to do more town meetings. We have to place ourselves in locations where someone may not have an internet access or online access in terms of how they will be able to be outreached to from a community standpoint in terms of having all their questions and their answers and their fears addressed related to, wow, what's the benefit of this for me taking this? Are there any side effects I may have to worry about? I may have a certain condition and I don't know whether I'm allowed to take this vaccination. But I want to reemphasize, we are going to put $1 million out there for our community-based organizations. They're the best in doing social networks of the people that we need to outreach for. They're the best in terms of doing that education, being able to answer those questions. We need to use those trusted community leaders who will have the education to address people in their communities, which I think will make a huge difference in terms of increasing the number of people, increasing vaccine confidence in the people we need to reach.
Thanks, Dr. Kane. We have a follow-up question from Eric Berman.
Yeah, I want to go back to my earlier question. Then, if I can, I have a vaccine question for Dr. Kane. Mr. Mayor, I'm regretting my use of the word intuitive. I guess what I'm really asking is, when we hit those 3 benchmarks that Dr. Kane outlined, is that flipping a switch? Ohio and New York have set, among others, have set policies, or if we hit this number, we can do X. Is that what we're saying, or will there be more going into that decision? And then, if there's time, I do have a vaccine question.
I'll tell you is we're looking at our 2 metrics, the positivity, and we're looking at the average number of cases, and that probably has to be around for at least 3 weeks. But we're also, a very major third factor for us is that herd immunity? So have we reached herd immunity for us to no longer recommend wearing masks, for example? So I need those three metrics, looking at that for us to return to normal activities. And lastly, I have to be observant of what's happening with the resistant strains. Are they doing a better job being more contagious than we are doing our vaccinations? But we're trying to get ahead of this real quickly. We also need to have availability of vaccine for us to reach our communities. And so those are the major factors we will be looking at from the science in terms of making our decision. And one last thing is, hey, the responsibility rests on our community. So if you wear your mask, wash your hands, doing social distancing, we will be there this summer. Hey, it's all about everybody. This is not a Mayor Hotset problem. This is not a Dr. Kane problem. This is not a media problem. It is all of our problems. It is all of our responsibilities to make that big difference in our community. It falls on everybody's hands.
Thanks, Dr. Kane. Eric, I think you might have had a follow-up vaccine question.
I did. Dr. Kane, sorry, I'll make a deal with my feedback here. Dr. Kane, you outlined some vaccine hesitancy issues. Do we know, to what degree do we know what's causing the lack of uptake? How much of that is hesitancy? How much of that is lack of access? What other factors are we seeing that potentially hold those numbers down?
So definitely we have vaccine hesitancy, but we're having more of a problem of people wanting the vaccine, and it's an access issue. And also it's a convenience issue too. Both the mayor, our president, city council, Bob Osley, and myself took the Johnson & Johnson vaccine. That's a one-time vaccine. I don't necessarily have to take two. So, when there's some hesitancy, you may say, well, I'm happy to take the one vaccine shot, but I don't think I'm going to take two shots. So I also think a lot has to do with our problem is we feel more, maybe a little bit with the access to the type of vaccines, and people can have choice in order to get vaccinated.
Thanks, Dr. Kane. I've got one more right now. Amelia from the Star.
Yes, this is for the mayor. Do you have any concern with the legislature still in session down the street that there may be any efforts to just go ahead and lift all of these restrictions statewide and not leave it up to the cities?
Well, Amelia, I would say I think the Marion County Department of Public Health and Dr. Kane specifically and especially have done a fantastic job of guiding us through this difficult year that we've been grappling with this global pandemic and how it has affected the residents of the city of Indianapolis. I do believe it's in the best interest of everyone to maintain the authority to be responsive at the local level. And I would hope that the members of the General Assembly, I trust that the members of the General Assembly appreciate the fundamental differences that Dr. Kane and I face in helping protect the people of the city of Indianapolis over and against what their individual experience from their community, wherever that might be around the state of Indiana, how it differs. And I believe that the Indiana General Assembly understands that. I trust their judgment, and I just ask them, and I have reason to believe that they will trust our judgment. And if we both do that, then I think our state and our city will be well served.
Thanks, Mayor. That's it for the questions that I see. Feel free to follow up with us if you have any additional. Stay tuned for a press release coming out from the Marion County Public Health Department in just a little bit with more details regarding some of the announcements Dr. Kane made this morning. Thanks, everybody. See you next time.